Also, today we are covering monitoring and evaluation in emergency projects. Yeah, how you can do your monitoring and evaluation in emergencies. When emergency occurs, how can you effectively monitor and evaluate that project? So, what are some of the emergency projects or situations? Some may have floods, in case floods are broken out and a project has to go there to save the people in case there are fire outbreaks, in case there is hunger. What about hunger in Karamoja? And then the World Food Organization had to intervene to give food to these people. Those are all emergency projects where you need to actually do a project promptly and also evaluate to see that the results were achieved in case there are conflicts or wars, in case there are mudslides, epidemics, and an epidemic like COVID-19 recently had, or a refugee influx. Yeah, and other emergency projects. So how do you actually monitor and evaluate emergencies? Yeah, so this is the project life cycle. One, the emergency occurs. Let's say the epidemic that was COVID that recently occurred. You assess the program, you assess the effect of that epidemic or that project in case of that disaster has occurred. Then you do your program design, how you're actually going to design the program to intervene for this intervention. Yeah. Then the actual implementation is taken place, like COVID-19, people put in place distancing measures, wearing masks. That was implementation. And then monitoring to see is the epidemic so on, is it growing strong, are people still falling sick, what are the death rates, the mortality rates, what are the curation rates. You saw that real-time monitoring and evaluation where data was being updated real time. Then you evaluate the disaster at the end of it all, like you saw the vaccines were produced and people are vaccinated. Yeah, so that's the project life cycle over managing a disaster or an emergency. So what do you look for actually when you're monitoring and evaluating emergency response programs? One, you look for achievement. What has been achieved in the response to this emergency project? Yeah, like with the COVID-19, what was achieved? We saw that the reduced mortality rates and people were more people healed from the COVID pandemic. Yeah, with the interventions that were put in place. How do we know that the project caused results? We're also assessing that there are some results. We're assessing progress against standards. Were the objectives met for this project? Is the level of assistance per individual family meeting the standards? If the gaps, is the project doing what the plan said or did do or intended? Yeah, is the project achieving the plans that were intended for it? For example, when the COVID-19 pandemic happened, the project plan was to have more people healed from the epidemic and also reduce and fight the epidemic and also prevent the epidemic from reoccurring. Yeah, so you're assessing what are the objectives and the plans for this intervention achieved. Yeah, you're also monitoring the project management. Was the project well managed in terms of resources? Were there any issues or bottlenecks? Should they be addressed? You're also identifying the strength and weakness of the project. Does the project need improvement? How can it be done? And are the original objectives still appropriate? You may have the set objectives, but you see that with your monitoring, evaluating a project after a year, you see that, oh, maybe I need to change the objectives of the project, and you change. Then you check for effectiveness. What is the difference in the project making? Can the impact be improved? Because there is an impact, but you need more improvement. Can we have more reduced maybe mortality rates or reduced hunger and people have more access to food? Yeah. Then you add also a monitoring evaluation to identify if there are any unintended impacts. There are any unintended issues or negative consequences arising out of this response. and how should this be addressed. Then you're also assessing the cost effectiveness for the costs used to attend to this disaster or emergency reasonable. Yeah. So what methods do you use in monitoring emergencies? One, you use remote monitoring. This is done in cases of extreme cases like war areas in Somalia, Iraq, South Sudan. Yeah, so there you can do remote monitoring because really high risk areas. There is the NGO-based methods such as call centers. You can use call centers and regular debriefing meetings with local partners. You can work with local partners in the region to actually monitor that emergency if you can't be there, like personally. Then you can work with the community-based methods such as crowdsourcing, broadcasts, complaint boxes, and consulting local communities. Yeah, in case of fire outbreaks or like hunger, then you can put in community complaint boxes where people are actually responding to the response that was given to them, and you get information you need. Then you can work with local partners such as photos and videos of distribution, web-based remote monitoring, daily verbal reports, and peer observations. Yeah, you can work with that. Also, another important one which is always done is the real-time monitoring. As I said, I gave that. It's a method that you have to use as a must. And when you're monitoring emergencies, like you saw COVID-19, that it was real-time. Every day the cases were being updated on the COVID-19 website. Every day they are monitoring how many people are getting the virus, how many people are healing from the virus, how many people are we losing, how can we intervene, what vaccines can we use. Yeah, it was real time. So in emergencies, you always have to use, that's a must method when you're monitoring emergencies, the real time evaluation, monitoring and evaluation. Even in hunger, you've seen the hunger project in Karamoja, it was real time monitoring. Are these people actually responding to the food that was given? How can we sustain this real time? Because you're actually responding to something that is so, as I said, an emergency is something that you have to respond to immediately, something that doesn't wait, like maybe another project which has a project live. This is something you respond to immediately, and that's why we do real-time monitoring and evaluation. Yeah, so what are some of the monitoring and evaluation systems you can use in monitoring emergencies? One, in the M&E systems, you need the M&E work plan for data collection analysis, also covering the baseline and ongoing M&E. Yeah, so your M&E work plan has to outline how you collect and analyze the data and what is the baseline. Sometimes you may find that there is no baseline, so you may use secondary data in monitoring emergencies. Then you need the logical framework, which includes indicators and means of sources of verification. Then the reporting flows and formats. How will you be reporting? What is the format of reporting? Feedback and review plan, you need that in monitoring emergencies, because as I said, you're always doing real-time monitoring. So if it's in cases of hunger, you need feedback from the people, their health and their needs, and then you need a review plan. Then you need a capacity building design. As I said, because you have an emergency, you may not have maybe the capacity building to handle that emergency, so you need that design to, maybe if the people need to be more educated on how to handle particular emergencies, like the pandemic that was recent. There's hunger. So you may need to have a capacity building plan in place, and guess we lack the resources, the human resource. Then an implementation schedule, that's a must. Then your human resource and the budget. So what are the examples of data collection methods you can use in monitoring and evaluating emergencies? We have the quantitative methods and qualitative methods. Quantitative methods, you can use structured or oral interviews or written interviews with close-ended questions. You can use population-based surveys. You can review your records, completing forms and tally sheets, direct measurement, load quality assessment. You can use such methods. And under qualitative, you can use same structured interviews, key formats interview, focus group discussions, observation methods, case studies, mapping, ranking, and scoring, problem sorting, and ranking. Those are some of the methods. So to simplify how to handle your M&E emergency, you can make sure you build into every stage of the program design and implementation. Yeah, so that the program is promoted or implemented effectively. Yeah, you can do spot checks if your staff no spot checks to check if things are going right. And you can evaluate your M&E functions, having internal reports to see if some falsified or bribe reports. Normally people can do that in emergencies when it's actually not doing work, so it's good for you to do that. Then have sufficient travel resources and field staff qualified in the M&E, and have a feedback mechanism for stakeholders to comment on the M&E reports and use easy or clear reporting formats. So how do you set up an M&E system in emergencies? Yeah, in an emergency project. 1, assess your M&E capacity and increase it to meet the emergency demands. So as I mentioned that if you see that capacity is not there, you can already assess, you can have a capacity building plan in place to increase the emergency demands. Then design a system that covers all parts of the response management. Develop an integrated M&E where you can have an information management system in place, the real-time information management system in tech. Set up indicators at the start of the response. So these are the indicators that will show us that we're actually achieving success in this response. Use various data collection methods and involve the community in data collection, because some of these emergencies are in far communities. It's very good to use the community-based approach to help you in data collection, and also for participatory monitoring and evaluation. Then decide on who will do what, either who will do the data collection, the analysis, and the review. Plan for monitoring, reporting, and feedback, and using results in the decision making. So you need these results all the time in your decision making, the real time decision making. Then include M&E in your project budgets. So in monitoring, what do you actually do? You're actually collecting age and sex disaggregated data from the beginning. The baselines, give feedback to the beneficiaries using the like language formats or channels. Collect and analyze data at the time that the events are occurring. Ensure that managers promptly review the monitoring activities and coordinate. Make sure to coordinate all the activities all the team members are doing. So you're coordinating. Make sure the activities are done well and met. And in evaluation, you can do an action review 2 to 3 months after the start of the emergency. Because these are more like short-term projects, but also like something you have to respond to immediately. So after 3 months, you can do an evaluation. Then organize for any program evaluation for a slow insert recovery. Consider joint evaluations, so coordinated responses. You can work with other partners to do the evaluations. And how do you do that? An effective results framework in emergencies. 1. An effective results framework in emergency should outline how the indicators will be defined and measured, the initial roles and responsibility for the collection and analysis of these indicators. I have a video on the M&E framework, so you can check it out. You can understand more about the resource framework. Outline the expectations of who will use the data and what type of decisions you're going to use for the data. Indicators of the initial baselines, you have to have them. More expected experts level. Specification of the indicators and process that will be used to effectively monitor the achievement of the project results. And also you should keep it very simple, realistic, and candid. And you should link your results framework to other management documents such as the strategy or national plans. Also recognize where the country is in relation to the emergency situation. Standards for M&E in emergencies. Have early monitoring systems that should be simple, user-oriented, flexible, and accommodate change in context and activities. 1. The standards include count your progress towards the outputs. Are you actually achieving the outputs stated? Check the appropriateness of the effectiveness of the response. Change the responses as needed based on the findings, and also communicate progress and results to the stakeholders. So these are very key standards in handling emergencies, in monitoring and evaluating emergencies. Counting your progress towards your outputs, checking the appropriateness and effectiveness of your response in case there are some needs to change your response, then change as based on the findings after you've checked, and then communicate your results. And also monitor the relevance, effectiveness, and quality of the response to increase the accountability to the people you serve and create a formal M&E system for the overall response as soon as the situation stabilizes. So that's how you can establish an M&E system for handling emergencies and how you can handle emergencies in M&E. That's it. Thank you very much. Like and share, subscribe to my channel. Thank you.